Okay, you're starting to record.
So supposedly, this is a dressing, you know, but we're gonna use
No,
it as
talk
a
for
gauze.
real, because I'm recording you.
Okay, well this is supposed to be, okay, a gauze with iodine, okay? So we disinfect the skin first, okay? We're gonna pat this here, okay? Medical assistant can do this. It has to be the surgeon or the physician.
Yes.
Okay, so this is used. So I can put this right here, or someone can hold it, okay? Then I'm gonna apply the anesthesia. I'm gonna remove the needle cap. It's supposed to be a smaller needle than this one because it's actually in the face. So let's guess that this one, let's assume that this is a smaller needle, okay? And I am going to infiltrate some kind of anesthesia hypodermically here. So one of you is supposed to have the gauze in your hand, and every time I pinch, I stick the needle in, okay? You pat a little bit, all right? So I'm gonna come here, and I am going to put this here, and I'm going to introduce a little bit of anesthesia, okay? Then I can open up this here and introduce a little bit of anesthesia here, and another little bit here, okay? And probably another little bit on this side of skin here. Okay, so now we need to wait a little bit, okay?
Don't forget to pat it. Hey, rise up, look up and talk.
So any questions so far? Everybody all right?
It's pretty straightforward.
Okay, so let's say that this patient who is supposed to be totally awake, okay? Now I'm gonna ask the patient if you feel anything, you feel this, you feel this, you feel this. You can grab a needle or a tweezer, and you can try to pinch a little bit and see if the patient feels something. If the patient refers and doesn't feel anything, we can proceed with the suture, okay? So at this point, we're gonna grab the suture, okay? Let's say that this one was inside of a package, cell package. Someone's gonna open it for me, and I'm gonna come here and adjust this here. It's everybody's different preferences, okay, in reference to this. I want some of you with a tweezer and some of you with a scissor, okay? No, scissors.
Scissors.
Okay, all right. And another one, you can, okay. So remember, if I have this cut here, which is from here to here, okay, first thing I need to do is to try to put or bring together the edges first at the center, okay? So I will do this. Grab the skin here. Come here. Skin is too hard. It's too thick. I'll grab this side, and then I will grab this side here. I will come here, which is not even the center, I can see very well. Okay, wait a minute, it's too hard. Let's say that this is the center here. Thank you. I'm gonna pass out, it's too hard.
Yes, it is.
Yeah, put it up.
Pull up the light.
Okay, so now I'm doing this here, see? I'm gonna help this needle because it's
Rough.
Can I bring this here? Okay. Now I can actually use this, okay? I'll keep it right here. Being already used, but anyways. 1, 2, but I'm gonna give only 1, so we can save some suture, okay? Usually the skin in this side of this part of the skin here doesn't require too much. This is not even the center of the thing, but anyways. So I'm gonna keep this knot to one side. So it's gonna be easier for whoever is gonna remove the stitch. Okay, so I'm gonna go again. Notice how I'm going to move the knot towards the side, okay? So whoever is going to come to remove this suture here has enough place to, to play with it. So,
To remove it.
my assistant, thank you very much. So we are done with the first one. And I grab this one with a curved Kelly. I'm going to grab this here. So I can either do this one or all the way at the end. I'm going to do this one here. It's going to be harder than the first one. I think I got it. At this point, someone is supposed to be padding because it can bleed. Okay. So Joseph, can you clean here because it's bleeding? Be careful with the needle. Okay. It's too delicate. Put some pressure. Okay. Yes, like that. Okay. So keeping this here, I will come here, grab this one.
Now, when you're actually doing it, how rough is the skin? Is it easier to
This
do it?
one,
No, like
a
on
real
a
person,
yeah.
it's not like this. It's way easier. Of course, it depends. Each part of the skin in different part of the body
It's
is
completely
different. You know, in each person it depends.
Under elasticity.
Yeah. I'm trying to save some suture here. So I'm not going to put it too tight so we don't break that fake skin. Can someone cut this here? Okay. So I think we have enough probably for another one. Let's grab the skin. Can you move my hair back? This side. Thank you. I can see. Part here is tough.
It's like you're doing real surgery.
Huh?
Looks like you're doing real surgery.
Yeah, because it's too hard. It's fake skin, but it's oof. The needle doesn't want to go in. Can you feel anything? No? Okay. Good then.
Okay, that's it.
No, wait a minute. I want to finish. But you know what? Skin here is horrible.
There we go.
Okay, well, it's not supposed to go that far.
Am I right?
Wait. Okay, now we got it. Okay. That's what I wanted to do. Oh my God. Wow. Thank you. Okay, you hold right there so I don't miss that one because it's too short. One. Sometimes depending on the type of tissue, two will be perfect. We will need to save some of this. Okay, I'm gonna do it one more time. I'm gonna try to bring the knot to one of the sides. Okay, come on, Joseph. Cut. More or less the same length of this one. Okay, thank you. So go to the needle disposal, be careful. Sharp container. Okay, so padding. Okay. So
You can't feel it.
actually like this, Joseph. It doesn't bite. You do this. You put pressure. Okay, you clean. Okay, now that it's clean, I can get a little bit of iodine and clean a little bit more of the edges. Okay. So now, let's say that we have some type of antibiotic, right? We can put it right here. Okay. And then we put adhesive bandage. Sometimes the bandage comes already with some kind of ointment and antibiotics also that can be removed the next day. You can leave it for 24 hours without touching it at all, okay? And then around 48 hours, more or less, we can uncover the wound, the incision, and let it dry, okay? And then we'll take a look at the edges, if it's red, if it's still bleeding, if it's inflamed, if the patient has pain, if it's accumulating pus, okay? So those are signs or symptoms that we need to follow after this type of procedure. Well, essentially, this is something very easy, right? And medical assistant, like I said, is not supposed to perform this kind of procedure, but at least you're supposed to assist and know what kind of instruments, what to tell the patient, instructions to the patient, how to have all the instruments and equipment ready to perform this type of thing. You need to differentiate what is the, remember the black field and the white field in the surgical asepsis. So white field is whatever is sterile. Dark field is whatever hasn't been is already used. Okay. So, well, basically we're done with this. Now, who is going to remove the first one? Do you know how to remove it? You have an idea?
No, by
Okay.
cutting it?
No, removing it.
removing
Let's
it.
say this patient came after, let's say, usually 7 days. Okay. So, if the incision looks healthy, the granulation tissue is already there, cicatrization process is good, okay? So what we can do is that we can grab one of these things and a scalpel, or we can use another suture removal kit. Sometimes it's not that good, okay? Sometimes we rather to use the tweezers or the Kelly, and also a scalpel or a scissor, okay? So the Kelly, this is Kelly, curved, okay? There's another type of Kelly which is straight. I don't see it here, it must be back there, okay? So they're grafting, okay? And I don't see a scalpel here, which is the one I like, but let's try to remove stitches with this one. So notice, this is the reason why I took the nuts all the way to the side, because it's going to be easier, okay, for whoever is going to remove it. In this particular, well, in my opinion, for me, I think it's way easier to use the scalpel, okay, because look at the scissor, okay, look at the ends, but I'm going to try to do it anyways. So it's supposed to be a smaller scissor, okay? You're going to grab this, you're going to bring it to the side, okay? And you cut here. The whole thing is out.
Oh, that's easy.
Okay? Now,
But some
not
of
always,
going to have a skin.
some of them are actually very tight, and during the granulation process, cicatrization, it is going to get a little bit deep into the skin. So you're going to have to pull up a little bit.
Yeah,
sometimes
hurts.
it hurts a little, okay, but it's not going to kill nobody. And sometimes I may actually bleed a little bit, okay, so you have to have gauze ready.
Yeah, this knows
okay?
very well.
So one of these things, you put it right here, okay? And then you come and grab the other one, and if it's too tight, the scalpel will be better. So you will use the scalpel, okay, with the edge
To
out,
dig it up.
okay? So you can actually, let's say that this is a scalpel, okay? Let's say that this part here is going to be the scalpel. So I'm going to use this scalpel, okay, and I will do this. Of course, scalpel will have a better edge than this, sharper than this. Doesn't work because it's not a scalpel, okay? So I'll cut down here, okay, and I'll pull it out. Who wants to do that? Okay, so Marisa is going to remove the other two. Come on. You can pull that one. You can pull this one too. So No. Exactly. Okay. Be careful with the skin in a real person. Okay. You can help your other hand doing this here with this one. Okay. So try to keep the edges together.
When you're pulling it.
Huh?
When you're pulling it.
Right. So you can put this one here or there. Okay. Who else? Who's gonna take this one off?
Joseph.
Come on, Joseph. Take the place.
How many minutes you got?
15:30. I'll edit it though. I have an edited program at home.
Okay. You have to pull whether you like it or not. And no, that's not the right position. Like this, it's not going to help you. So you have to do this. Okay.
Pull it.
You have to pull. See, this is something that is not supposed to happen because you are cutting
broke.
one and you are leaving something there. See? So that's not
So
supposed to
you wasn't
happen.
looking where you was cutting at.
Because you have to pull. You know, remember, this is fake skin, but it can happen with real skin. Okay?
What'd you do? You didn't clean it.
Well, at this point, we are done with this.
How many times?
Who has questions?
No,
I think it's
we're
pretty
good.
straightforward, right?
Yeah. Mr.
Okay.
Dummy looks happy with his fake teeth.